Cough suppression. A cough is a reflex reaction in the respiratory tract produced by the body to clear the upper airway. Coughing clears the larynx, trachea, large bronchi of mucus, foreign particles, and infectious organisms. Chronic cough can lead to vomiting, rib fractures, urinary retention problems, muscle pain, and fatigue. This image highlights the cough receptors in the body with red dots. It is estimated that chronic cough accounts for about 10 to 38% of respiratory outpatient practice in the United States. Chong and Pollard distinguished adult chronic cough from that of a lingering cold as a cough that has lasted for at least 8 weeks. Chang and Glomb identified pediatric chronic cough as that lasting more than 4 weeks. Chronic cough can affect those with respiratory-related problems like bronchitis, those with irritable larynx, acid reflux, and habitually practice such behaviors as throat clearing and smoking cigarettes. Some of the common pathologies related to cough include irritable larynx syndrome, laryngopharyngeal reflux, irritants, laryngitis, hyperfunctional voice disorders, gastroesophageal reflux, and respiratory-related problems. However, this list does not capture the extensive etiologies of cough. Irritable larynx is often associated with acid reflux or an illness such as the cold or the flu. It consists of an array of disorders ranging from chronic cough and throat clearing to laryngospasms and paradoxical vocal fold motion.
Irritable larynx syndrome in all of its forms is a complex disorder. The increased familiarity with the common and less common triggers is vital for proper diagnosis and treatment planning. Some of the primary triggers of irritable larynx syndrome include psychological conditions, upper airway sensitivity to irritants such as gastroesophageal reflux disease, also known as GERD, and various neurological etiologies such as laryngeal dystonia. In some instances, symptoms can resemble asthma. However, anti-asthma treatments have proved ineffective. Gastroesophageal reflux disease, also known as GERD, is the cause of chronic cough in 40% of chronic cough patients. This disease is the backflow of stomach fluids into the esophagus. This sensation is commonly described as heartburn. It should also be noted that chronic cough only intensifies the symptoms of gastroesophageal reflux disease. Laryngitis is a commonly known illness related to chronic cough and is characterized by an inflammation of the larynx. Like many other previously discussed topics, laryngitis is commonly caused by colds and the flu, as well as acid reflux, voice overuse, and irritation. The primary symptom related to laryngitis is a hoarse, raspy voice. Other symptoms include sore throat, coughing, and trouble swallowing.
Laryngitis typically lasts up to 2 weeks. However, when and if symptoms proceed longer than 2 weeks, it is considered chronic laryngitis. In the majority of cases, laryngitis typically dissolves with voice stress and drinking plenty of fluids. Some common irritants include mucus, foreign substances, and habit-forming actions like inhalation of smoke and throat clearing. Believe it or not, mucus in the respiratory tract is actually a good thing. The problem occurs when there is too much or too little being produced. Cigarette smoke, for example, irritates the tissue in the nose, throat, and lower airway, causing inflammation. The cilia in the respiratory tract is inhibited and mucus production is decreased, drying out the respiratory tract. Even if you yourself do not smoke, being in the company of those that do is just as harmful, if not more. If you are constantly clearing your throat, this habit may have started as a compensatory measure for the presence of an irritant in your airway. When the airway is irritated, cough can be triggered by a number of things, including cold air and foreign substances like perfume, odors, pollution, and dust particles. Asthma, bronchitis, and allergies are some example conditions that affect the respiratory system and cause chronic cough. Asthma may occur in isolation or as a result of smoking. A couple of ways to treat asthma conditions include the use of inhaled bronchodilators and inhaled corticosteroids. These medications reduce inflammation of the airway. Bronchitis is a condition in which the passageways in your lungs become infected and inflamed. In addition to chronic cough, this condition causes chest congestion, fever, and aches similar to the flu. Asthma treatment might be recommended to reduce inflammation. Allergy triggers to the airway system include pollen, mold, dander, dust, food, and medication. These triggers may contribute to congestion and postnasal drip.
One thing that you can do to aid in cough suppression is changing your habits. This may include ceasing to smoke cigarettes, switching to low tar or low nicotine options, and even limiting company with those that smoke. It is recommended that smokers consume 2 to 3 quarts of water per day in order to reduce the drying effects of smoke. Instead of forcefully producing a cough or clearing your throat when your airway is irritated, softly hum, or you can swallow gently. If your cough is caused by acid reflux, a simple solution is to reduce the acid-forming foods in your diet or by taking acid-reducing medications. Antihistamines are helpful in reducing the production of mucus and limiting other symptoms like runny nose or itchy eyes, as is seen with allergies. One behavioral strategy that will aid in reducing airway irritation is ceasing phonotraumatic behaviors. This includes yelling, screaming, excessive talking, or talking in an inappropriate way. You shut the not that inappropriate way, such as whispering or in a higher pitch than normal. Vocal health education is beneficial because it addresses various topics like appropriate hydration and how to produce low-impact voice. Low-impact voice may reduce irritation of the airway to trigger cough less often.